Welcome. Let's dive into the harsh conditions faced by California Native Americans, exposing the hidden truths of California missions. The historical and ongoing impacts of oppression far extend the Central Valley. We've seen a repackaging of the American Indian genocide, exposing the wounds of colonialism. Let's focus on health issues that affect every tribe throughout the diverse landscape here in California. Also see efforts to bridge cultural and medical practices in every major city and town, beating a history of greed, power, and corruption, while also being able to tear down the false food pyramid. This is Anthro Today. I'm Sam Lopez, and this is Debunking Diabetes: How White Medicine Has Failed California Native Americans. The rise in obesity rates has contributed to the increasing prevalence of diabetes, especially within type 2 amongst California Native Americans. Native Americans in California face disproportionately high rates of diabetes, making it a critical public health crisis in the state. The alarming disparity calls for targeted intervention and support to address the unique challenges faced by Native communities. So then why is it that around the 1980s, we see a huge spike in diabetes? In the 1980s, media heavily promoted the USDA food pyramid, emphasizing high-carb, low-fat diets. This led to an increase in processed foods and sugar intake, contributing to the spike in diabetes rates we're now facing today. The USDA, without needing to pass any new votes, pushed the food pyramid, a plan heavily influenced by powerful ag business stakeholders. This top-down approach, prioritizing high-carb and processed foods, ignored the traditional and healthier diets of Native American communities, contributing to the high rise in diet-related diseases. The belief in manifest destiny drove American expansion westward, leading to the forced relocation and brutal violence against the Native American communities. The relentless push for the westward expansion not only stripped Native Americans of their ancestral lands, but also severely limited their access to vital resources. The California Gold Rush further accelerated these issues as settlers flooded the region, intensifying conflicts and displacing even more Native American communities. The 1850 American Indian Act was a tool of systematic oppression, enabling the U.S. government to carry out acts of genocide against tribes. The brutal policy facilitated the forced removal, sanctioned violence, and led widespread seizures of indigenous lands. However, the California missions played an even huger role in the systematic oppression and assimilation of Native American tribes. Under the guise of religious conversion and civilization, these missions facilitated the forced labor, cultural destruction, and harsh treatment of indigenous people, leading to significant suffering and population decline. The mission also opened up boarding schools with the sole purpose of eradicating indigenous culture by imposing European customs, languages, and diets. Traditional foods and practices were replaced with European agricultural methods, leading to a loss of cultural identity and traditional knowledge. For example, the mortality rate at Mission San Miguel was alarmingly high due to epidemics and exposure to new diseases. Harsh living conditions, malnutrition, and overwork contributed significantly to the high death toll. The forced relocation and cultural disruption led to psychological stress. Another example is Paris Indian School, where they aimed to assimilate children by stripping them of their cultural identities. The school enforced English use, Western dress, and Christian religious practices, eradicating traditional custom and diets. Native children as young as 5 were taken from their homes and placed in boarding schools like those in Paris. Stripped of their cultural identities, they were forced to adopt Western diets that clashed with their traditional nutrition. These harsh conditions led to the deaths of an estimated 900 Native children. These institutions aimed to erase their native languages, severing their ties to cultural identity and traditional knowledge. This loss of language created a barrier to understanding and accessing Western medical practices, leaving many Native Americans disconnected from vital healthcare resources. The loss of language among California Native Americans significantly disrupted the transmission of traditional ecological knowledge. Tech is a body of knowledge that encompasses the cultural practice, skills, and wisdom developed over centuries of interaction with the environment. This includes information about local ecosystems, plant and animal behavior, sustainable harvesting techniques, and natural resource management. Now, before we shift our attention to the Klamath tribes, including the Yurok and Karuk, who both face difficulties with diabetes and fishing rights, let's point out 2 key factors moving forward. In order to pave a new future forward, we have to reimagine the food pyramid that involves incorporating traditional foods and ecological knowledge that are both nutritious and sustainable. fostering a sense of cultural identity and environmental knowledge. We also have to accept that in California, food deserts do exist. And to combat this, we do have to advocate for policy change and secure partnerships and grants to ensure access to nutrition and culturally relevant food. For example, the Klamath Food Security Program aims to enhance food security and health in the Klamath Basin by building a sustainable regional food system. A few key components of the program include creating jobs and training food crews, innovative food distribution networks, and providing nutrition, education, and cooking classes. These help the community learn about healthy eating and cooking practices. Understanding the full picture of Native American history and culture is crucial to grasping why Western medicine often fails these communities. This includes recognizing the impacts of language loss, cultural disruption, and historical trauma. Only with this comprehensive understanding can we address the shortcomings of Western medical practices and work towards solutions that respect and integrate Native traditions and knowledge. Now we can focus our attention to some of the leaders in change. The Yurok and Karuk tribes have been at the forefront in incorporating traditional practices, rituals, and diets into their community life. They have implemented programs focusing on sustainable regional food systems that include traditional foods such as salmon, deer, elk, acorns, and berries. By establishing community gardens and providing nutritional education, the tribes are preserving their cultural heritage while improving food security and health. Their efforts also include engaging youth and elders in identifying and addressing community health barriers, which helps to ensure that traditional knowledge and practices are passed down through generations. So how do we break down some of these barriers? Well, for starters, Western medicine can incorporate elements of some of these ceremonies to gain a deeper understanding of the importance of spirituality, community, and natural remedies in the healing process. This can lead to more culturally sensitive care, fostering trust and cooperation between medical practitioners and Native American communities. Moreover, it emphasizes the need for a more integrated approach that values traditional knowledge and practices alongside modern medical techniques. Recognizing and respecting these traditions in medical training can enhance the effectiveness of healthcare delivery to Native American patients, ensuring that their cultural heritage is honored and their unique health needs are met. In understanding the profound impact of colonization and the resilience of California Native Americans, we recognize the importance of preserving their cultural heritage and integrating traditional knowledge with modern healthcare. By addressing language and cultural barriers in medicine, we can honor their past, support their present, and foster a healthier future for all. Together, we can build a bridge between history and healing, ensuring that lessons of the past guide us towards a more inclusive and compassionate future.